A rare occurrence, the enigma of menstruation. Menstruation, the shedding of the uterine lining, is a process shrouded in evolutionary mystery. It is a relatively rare phenomenon in the animal kingdom, observed primarily in humans, some species of monkeys and apes, bats, and possibly elephant shrews. Why this process evolved and persists in these select species is a question that has puzzled scientists for years. From a purely biological standpoint, menstruation might seem counterintuitive. It involves the expulsion of blood and tissue, representing a loss of nutrients and energy. Additionally, the physical experience of menstruation can be uncomfortable, even debilitating for some. So why then would such a seemingly wasteful and inconvenient process evolve? The cost of creation, nutrient loss and physical discomfort. The most apparent downside of menstruation is the loss of blood and nutrients. Every month, the body invests resources in building a nutrient-rich lining in the uterus, preparing for a potential pregnancy. When pregnancy doesn't occur, this lining is shed, leading to the loss of valuable iron and other essential nutrients. Beyond the nutritional cost, menstruation can also be physically taxing. Many women experience cramps, bloating, headaches, and fatigue during their periods. In some cases, these symptoms can be severe enough to interfere with daily activities. The evolutionary benefits of menstruation must therefore outweigh these seemingly significant costs. A biological tug-of-war, mother versus fetus. To understand the evolutionary advantage of menstruation, we need to delve into the complex relationship between a mother and her developing fetus. The mother's body is essentially a vessel, tasked with providing nourishment and protection to the growing fetus. However, this relationship is not always harmonious. An underlying evolutionary conflict exists between a mother's body and the fetus she carries. While the mother aims to distribute her resources evenly among all potential offspring, the fetus, with genes from both parents, prioritizes its own survival and growth. This can lead to a biological tug-of-war, with the fetus demanding more resources than the mother might willingly provide. Section 4. The placenta lifeline and potential threat. At the heart of this conflict lies the placenta, a remarkable organ that develops during pregnancy. The placenta acts as a lifeline between mother and fetus, facilitating the exchange of nutrients, oxygen, and waste products. For example, the fetus can release hormones that cause the mother. It also produces hormones that influence the mother's physiology, often to her detriment. Some placentas are deeply invasive, penetrating the mother's uterine wall and tapping directly into her bloodstream. This allows the fetus more direct access to maternal resources, but also increases the potential risks for the mother. For example, the fetus can release hormones that cause the mother's blood vessels to dilate, increasing blood flow and nutrient delivery to itself. While beneficial to the fetus, this can lead to fatigue, high blood pressure, and even life-threatening conditions like preeclampsia and gestational diabetes in the mother. Section 5. Implantation, a biological screening process. Menstruation, in this context, can be viewed as a protective mechanism for the mother. Before a pregnancy can establish itself, the embryo must first implant into the lining of the uterus, a process known as implantation. The endometrium, the inner lining of the uterus, is not merely a passive host. It plays an active role in screening embryos, ensuring only healthy ones implant. During implantation, a complex dialogue of hormones occurs between the embryo and the mother's body. The embryo releases signals that indicate its health and viability. The mother's body, in turn, responds with hormones that either support or reject the implantation. If the embryo is deemed unfit, perhaps due to genetic abnormalities or developmental defects, the implantation process fails, and the embryo, along with the enriched endometrial lining, is expelled from the body. This shedding of the uterine lining is what we know as menstruation.